Hello, my name is Dr. Sonja Rasmussen. I'm a pediatrician and epidemiologist, and I'm working with the Texas Council for Developmental Disabilities. I'm also a clinical geneticist, so I've worked for many years with persons with developmental disabilities, adults and kids. In addition, I'm a sibling. I'm a sister of an adult young man with Down syndrome. It's my pleasure to talk to you tonight about some of the common questions asked about COVID-19 vaccines. And I'm going to go through these series of questions, ones that I'm asked frequently, and I hope that they will respond to many of your questions. One of the first ones is, are people with intellectual disabilities at increased risk for severe disease from COVID? Several studies have shown this to be the case, that persons with intellectual disabilities are at higher risk of getting COVID-19 in the first place, and in particular, in having more severe disease. We don't completely understand why that is. Is it because persons with intellectual disabilities may be more likely to have some sort of underlying condition, like a heart defect or another kind of health problem that puts them at increased risk from COVID-19? Is it because of increased exposure, or is it because of challenges with wearing masks and other ways to protect against COVID-19? What this means is that it's particularly important for people with intellectual disabilities to be protected by receiving the COVID-19 vaccine. So one of the questions that I'm asked frequently is, well, what about natural immunity? Is natural immunity better than getting immunity from the vaccine? And we're still learning a lot about immunity from COVID-19, but what we know is that natural immunity does provide some protection. It seems to wane more quickly. It seems to go down more quickly than the immunity from the vaccine. And it also seems to be a little more specific. So it seems to not be covering as well for these new variants that we're seeing, where the immunity from the vaccine, when people get the vaccine and then get their boost, that seems to be a better protection, a longer lasting protection and better protection than what you would get from natural immunity. The other issue with natural immunity is, to get natural immunity, you first have to get COVID-19. And of course, COVID-19, many people have mild effects, but not all. Some people can be severely affected, as we talked about, especially people with intellectual disabilities. And also some people can be hospitalized or even die from COVID-19. So I think the real plan is that it's important to get get immunity from the vaccine, not count on natural immunity. What if you've already had COVID-19, or what if your adult with developmental disability has already had COVID-19? It's still important to get the vaccine. It's been shown that getting that vaccine improves the chances of having strong protection at the time in the future when a person might see the virus that causes COVID-19. The next question is, did COVID-19 vaccines go through the usual testing for vaccines? And this is something, I think, because the vaccines came up rather quickly, and about a year after we knew about COVID-19, we had a vaccine available. It's made people concerned. Did they really go through all the testing for vaccines? The good news is these vaccines went through extensive testing, actually more testing than most medications that we see on the market or other vaccines. They were tested in tens of thousands of people. And why was this possible? This was possible because our federal dollars were put forth to get a vaccine as quickly as possible because of the damage that COVID-19 was doing, causing severe illness and death in people. So they went through the full clinical trials with a placebo side, just like other vaccines went through. And they also had careful studies for safety. The other reason, the other piece of information that's important with relation to COVID-19 vaccines is there's also been a very careful safety analysis being done by the FDA and the CDC, and they have been looking for any possible adverse effects to those vaccines. And what they found is these vaccines are quite safe. So the good news is these vaccines went through the usual testing and they've shown to work, they're effective, and they're shown to be safe. The next question, and we hear this a lot with the flu vaccine too. Can you get COVID-19 from the COVID-19 vaccine? The best way to answer this is to explain a little bit about how the COVID-19 vaccine works. The COVID-19 vaccine works by giving a person basically a recipe, a set of instructions of how to make a little tiny piece of the COVID-19 virus. So the person isn't being exposed to the whole virus itself, they're being exposed to a little tiny piece of that virus. And that means that it's not possible to get the COVID-19 disease from the vaccine. The virus is not contained in that vaccine. All that's contained is almost like a recipe, the instructions for that spike protein, that little piece of the protein that sticks off. What that does is once your body sees that spike protein, we know that it makes that our immune systems ramp up and they say, I'm ready for the next time I see this virus. So if in the future a person is exposed to COVID-19 virus, their body is ready to go and ready to tackle it and keep them from getting severely ill. Another common question is, do COVID-19 vaccines cause infertility? This is a question that has come up so frequently, sometimes spread on social media, and it is absolutely false. COVID-19 vaccines do not cause infertility. There is absolutely no evidence for infertility occurring after getting COVID-19 vaccines. And in fact, even when the clinical trials were done and people were asked to not get pregnant, several women got pregnant. So we know that even if you've gotten the vaccine, you can get pregnant. We haven't seen any differences in the birth rate after COVID-19 vaccines became available. So there really is no evidence of COVID-19 vaccines causing infertility. So I know many of you have questions, and it's a big decision to decide to get the vaccine for yourself and to get a vaccine for your adult or child with a developmental disability. And so I understand that people have a lot of questions. If you still have questions after listening to this video, you can talk to your doctor. Doctors are ready to talk to you about getting the vaccine and about the importance of getting the vaccine. You can also send questions to the Texas Council for Developmental Disabilities, and they will help you get answers to your questions. And I think one of the things that I want to directly address is that many people are saying, well, maybe I should wait and see. Maybe I should wait and see. Well, now this vaccine has been out for a full year, and we have had a lot of information about it. We now know that these vaccines are safe and they're important to get. We know that persons with intellectual and developmental disabilities are at increased risk of COVID-19 vaccine. We also know that we're entering the time of the year when last year we saw a spike. And we're entering a time when there's a new variant, the Omicron variant. All of these pieces of information tell us it's more important than ever for you to get the vaccine yourself. If you haven't received the booster, it's time to get that booster. And it's time for your adult or child with developmental disabilities to get vaccinated as well. Thank you so much.